Question 1. Risk assessment procedures indicate that during a complex abdominal surgery, a surgical assistant inadvertently touches the sterile glove of the scrub nurse with a non-sterile instrument. The scrub nurse immediately retracts her hand, but the instrument made brief contact with the glove. What is the most appropriate immediate action for the perioperative nurse to take to ensure patient safety and maintain sterile technique? Option A. The scrub nurse should immediately replace her contaminated glove, and the instrument should be removed from the sterile field and replaced with a sterile one. The surgical site should be assessed for any visible signs of contamination. Option B. The scrub nurse should attempt to wipe the glove with an antiseptic solution to re-sterilize it before continuing. Option C. The procedure can continue as planned, as the contact was brief and unlikely to cause significant contamination. Option D. The scrub nurse should discard the glove, but the instrument can remain in the sterile field if it was only briefly exposed. Correct answer is A. The scrub nurse should immediately replace her contaminated glove, and the instrument should be removed from the sterile field and replaced with a sterile one. The surgical site should be assessed for any visible signs of contamination. Explanation. Scenario analysis. This scenario presents a common challenge in perioperative settings where a potential breach of sterile technique occurs during a critical phase of surgery. The challenge lies in the immediate need to assess the risk of contamination, determine the appropriate corrective action, and ensure patient safety without compromising the surgical field unnecessarily. The perioperative nurse must balance the imperative of maintaining sterility with the practicalities of surgical workflow and the potential impact of interventions on the patient's outcome. Correct approach analysis. The correct approach prioritizes patient safety by immediately addressing the potential breach, removing the contaminated instrument, and replacing it with a sterile one, while also assessing the surgical site for any signs of contamination, aligns with the fundamental principles of asepsis and sterile technique as mandated by professional nursing standards and regulatory bodies governing perioperative practice in the U.S. This proactive intervention minimizes the risk of surgical site infection, SSI, a critical patient safety concern. The immediate reporting and documentation also ensure accountability and contribute to quality improvement initiatives. Incorrect approaches analysis. One incorrect approach involves continuing the procedure without addressing the potential contamination. This directly violates the principles of sterile technique and the regulatory requirements for preventing healthcare-associated infections. It demonstrates a failure to uphold the nurse's ethical and professional responsibility to protect the patient from harm, potentially leading to an SSI. Another incorrect approach is to simply discard the instrument without further assessment or reporting. While removing the contaminated item is necessary, failing to assess the surgical site for contamination or to document the event is a significant oversight. This neglects the comprehensive approach to risk management and quality assurance, hindering the ability to identify trends or implement preventative measures. A third incorrect approach is to attempt to re-sterilize the instrument in the sterile field. This is not a recognized or safe practice for instruments that have been exposed to a non-sterile environment during a procedure. It is highly unlikely to achieve sterility and poses a direct risk of introducing microorganisms into the surgical site, violating fundamental principles of asepsis. Professional reasoning. Perioperative nurses must employ a systematic decision-making process when faced with potential breaches of sterile technique. This involves 1. Immediate identification of the breach. 2. Rapid assessment of the risk to the patient. 3. Prompt implementation of corrective actions to mitigate risk, prioritizing patient safety. 4. Thorough documentation of the event and actions taken. 5. Communication with the surgical team. This process is guided by established standards of practice, regulatory guidelines, such as those from the Association of Perioperative Registered Nurses (AORN), which are foundational for CNOR certification in the U.S., and ethical obligations to the patient. Question 2. The control framework reveals that a perioperative nurse is assigned to a variety of surgical specialties throughout their rotation, including neurosurgery, cardiothoracic surgery, and orthopedic surgery. Which of the following actions best demonstrates the nurse's commitment to providing safe and competent care across these diverse specialties? Option A. Relying solely on general perioperative nursing knowledge and assuming that skills are transferable across all surgical disciplines. Option B. waiting for the surgeon to explicitly instruct on the use of specialized instruments or equipment unique to each surgical specialty. Option C. Prioritizing speed and efficiency in room setup to ensure the surgical team can begin procedures promptly, even if it means skipping detailed review of specialty-specific instruments. Option D. Actively seeking out educational resources, attending specialty-specific workshops, and collaborating with experienced colleagues in each surgical area to enhance knowledge and skills. The correct answer is D. Actively seeking out educational resources, attending specialty-specific workshops, and collaborating with experienced colleagues in each surgical area to enhance knowledge and skills. Explanation. The control framework reveals the critical importance of a perioperative nurse's role in ensuring patient safety and optimal outcomes across diverse surgical specialties. This scenario is professionally challenging because the nurse must integrate specialized knowledge of different surgical procedures, instrumentation, patient populations, and potential complications into their practice, while adhering to the stringent standards set by the CNOR framework. Effective judgment requires a deep understanding of the unique demands of each specialty and the ability to anticipate and respond to emergent situations. The correct approach represents best professional practice because it emphasizes the nurse's proactive engagement in acquiring and applying specialty-specific knowledge. This aligns with the CNOR commitment to evidence-based practice and lifelong learning, ensuring that the nurse is adequately prepared to manage the complexities of various surgical settings. By actively seeking out educational opportunities, collaborating with surgical teams, and staying abreast of advancements, the nurse upholds their ethical and professional responsibility to provide competent and safe patient care, as mandated by professional nursing standards and regulatory bodies governing perioperative practice in the U.S. An incorrect approach that focuses solely on general perioperative skills without seeking specialty-specific knowledge fails to meet the CNOR expectations for advanced practice. This could lead to errors in instrument identification, incorrect setup of specialized equipment, or a delayed response to unique surgical complications, thereby violating the fundamental principle of patient safety and potentially breaching professional standards of care. Another incorrect approach that relies exclusively on the surgeon's direction without independent critical assessment overlooks the nurse's autonomous role in patient advocacy and safety. While collaboration is essential, the perioperative nurse is expected to exercise professional judgment and identify potential risks or deviations from expected care, even if not explicitly directed by the surgeon. Failure to do so can result in compromised patient care and a violation of professional accountability. A further incorrect approach that prioritizes efficiency over thorough preparation, such as rushing through the setup of specialized equipment, directly contravenes the CNOR emphasis on meticulous attention to detail and adherence to established protocols. This can lead to critical equipment malfunctions or missing instruments, directly impacting surgical outcomes and patient safety, and is a clear deviation from best practices in perioperative nursing. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific surgical specialty and its unique requirements. Second, assess personal knowledge and skill gaps related to that specialty. Third, proactively seek out relevant educational resources, mentorship, and hands-on experience. Fourth, engage in open communication and collaboration with the surgical team to clarify expectations and anticipate needs. And finally, maintain a vigilant and critical mindset throughout the perioperative process, prioritizing patient safety and adherence to established standards of care. Question 3. The monitoring system demonstrates a sustained increase in the patient's pulmonary artery wedge pressure, PAWP, by 8 mmHg above baseline, accompanied by a slight decrease in mean arterial pressure, MAP, and a mild increase in heart rate, while the patient is undergoing a complex aortic valve replacement. The surgical team has not yet initiated cardiopulmonary bypass. What is the most appropriate immediate nursing action? Option A. Notify the anesthesia provider and surgeon of the observed trends, requesting a comprehensive cardiovascular assessment and consideration of fluid management or inotropic support. Option B. Administer a bolus of intravenous fluids to address the potential hypovolemia contributing to the elevated PAWP. Option C. Document the changes in the patient's record and continue to monitor the PAWP for further increases before intervening. Option D. Increase the rate of mechanical ventilation to improve oxygenation and potentially reduce the POP. The correct answer is A. Notify the anesthesia provider and surgeon of the observed trends, requesting a comprehensive cardiovascular assessment and consideration of fluid management or inotropic support. Explanation: this scenario is professionally challenging because it requires the perioperative nurse to interpret complex physiological data in real time and correlate it with the patient's surgical context and underlying cardiovascular condition. The implications of cardiovascular compromise during surgery are significant, potentially leading to adverse outcomes including myocardial infarction, stroke, or even death. The nurse's ability to accurately assess the situation and initiate appropriate interventions is critical for patient safety and adherence to standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic assessment that integrates multiple data points. This aligns with the core principles of perioperative nursing as outlined by professional organizations and regulatory bodies, emphasizing patient advocacy, evidence-based practice, and the maintenance of a safe surgical environment. Specifically, it reflects the CNOR responsibility to anticipate and respond to physiological changes, ensuring that interventions are timely and evidence-based, thereby minimizing patient risk and optimizing outcomes. This approach is consistent with the ethical obligation to provide competent care and uphold the patient's right to safety. An incorrect approach that focuses solely on one isolated parameter without considering the broader clinical picture is professionally unacceptable. This demonstrates a failure to perform a holistic patient assessment, which is a fundamental nursing responsibility. Such an approach could lead to misinterpretation of data, delayed or inappropriate interventions, and potentially harm to the patient. Ethically, it violates the principle of non-maleficence, do no harm, and beneficence, act in the patient's best interest. From a regulatory standpoint, it falls short of the expected standard of care for a perioperative nurse, potentially leading to deviations from established protocols and guidelines for patient monitoring and management. Another incorrect approach that involves waiting for a significant deterioration before acting is also professionally unacceptable. Perioperative nursing emphasizes proactive monitoring and early intervention. Delaying action until a crisis point is reached increases the risk of irreversible damage and complicates management. This approach demonstrates a lack of vigilance and an abdication of the nurse's role in preventing adverse events. It contravenes the principles of patient safety and risk management, which are paramount in the surgical setting. The professional decision-making process for similar situations should involve a structured approach. 1. Continuous monitoring and data acquisition. Actively observe all relevant physiological parameters. 2. Data interpretation and correlation. Analyze individual data points in the context of the patient's baseline, surgical procedure, and known comorbidities. 3. Recognition of deviations. Identify trends and significant changes from the patient's normal or expected physiological state. 4. Hypothesis generation. Consider potential causes for the observed deviations, particularly those related to cardiovascular function. 5. Intervention and communication. Implement appropriate nursing interventions and promptly communicate findings and concerns to the surgeon and anesthesia provider. 6. Reassessment. Continuously evaluate the patient's response to interventions and adjust the plan of care accordingly. Question 4. Process analysis reveals that a competent adult patient scheduled for a necessary surgical procedure has clearly and verbally refused to undergo the surgery after receiving detailed information about the risks, benefits, and alternatives. The surgical team, including the surgeon and anesthesiologist, believes the procedure is vital for the patient's long-term health and expresses concern about the potential negative consequences of delaying or foregoing the surgery. The perioperative nurse is tasked with ensuring the patient's rights are upheld while also facilitating the care plan. Which of the following actions best reflects the perioperative nurse's ethical and legal obligations in this situation? Adhering strictly to U.S. regulatory frameworks and professional nursing standards. Option A. Proceed with the surgery as scheduled, as the surgical team has determined it is in the patient's best interest, and document that the patient was informed of the necessity of the procedure. Option B. Document the patient's refusal thoroughly, inform the surgeon of the patient's decision, and advocate for the patient's right to refuse, ensuring no further action is taken without the patient's renewed informed consent. Option C. Delay the surgery and initiate a formal capacity evaluation by a psychiatrist without the patient's explicit consent, based on the surgical team's concern about the patient's judgment. Option D. Gently persuade the patient to reconsider their decision by highlighting only the positive outcomes of the surgery and downplaying the risks to ensure the procedure proceeds. Correct answer is B. Document the patient's refusal thoroughly, inform the surgeon of the patient's decision, and advocate for the patient's right to refuse, ensuring no further action is taken without the patient's renewed informed consent. Explanation. Scenario analysis. This scenario presents a common ethical and legal challenge in perioperative nursing, where a patient's autonomy conflicts with the perceived best interests of the patient as determined by the healthcare team. The challenge lies in balancing the patient's right to refuse treatment, even if that refusal may lead to a negative outcome, with the nurse's professional duty to advocate for the patient and ensure their safety and well-being. The legal framework governing this situation in the U.S., particularly concerning informed consent and patient rights, is paramount. Correct approach analysis. The correct approach prioritizes the patient's right to self-determination and informed consent, which are fundamental ethical and legal principles in U.S. healthcare. A competent adult patient has the legal right to refuse any medical treatment, even if that refusal is life-threatening. The nurse's role is to ensure the patient has received adequate information to make an informed decision, to assess the patient's capacity to make that decision, and to document the process thoroughly. This aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes patient autonomy and the nurse's role as an advocate. Legally, respecting a competent patient's refusal of treatment prevents potential claims of battery or assault. Incorrect approaches analysis. An approach that involves overriding the patient's refusal based on the nurse's or physician's judgment of what is best for the patient is a direct violation of the patient's autonomy and legal rights. This could lead to legal repercussions for battery. An approach that involves delaying the procedure to seek further opinions without the patient's consent or without a clear indication of the patient's lack of capacity is also problematic. While seeking consultation can be appropriate, it should not be used as a means to circumvent a patient's informed decision or to coerce them. This could be seen as a violation of the patient's right to timely care and decision-making. An approach that involves proceeding with the surgery without a clear, documented informed consent, or after the patient has explicitly withdrawn consent, constitutes a serious ethical and legal breach. This is a violation of the patient's right to bodily integrity and can result in significant legal liability for the healthcare providers and institution. Professional reasoning. Perioperative nurses must employ a decision-making process that begins with assessing the patient's capacity to make decisions. If the patient is deemed competent, the nurse must ensure the patient has received comprehensive information about the procedure, its risks, benefits, and alternatives, and that they understand this information. The nurse should then respect the patient's autonomous decision, whether it is to consent or refuse. If there are concerns about the patient's capacity, the nurse should follow established protocols for capacity assessment, which may involve consulting with the healthcare team and potentially a legal or ethics committee. Documentation is critical at every step to protect both the patient and the healthcare provider. Question 5. Governance review demonstrates a need to enhance the consistency and accuracy of preoperative patient risk assessment within the perioperative department. Which of the following actions best addresses this governance finding by ensuring adherence to established professional standards for risk stratification? Option A. Encouraging individual practitioners to use their own preferred methods of risk assessment based on personal experience, without a standardized framework. Option B. Delegating the sole responsibility for preoperative risk assessment to the surgeon, with the expectation that they will communicate any identified risks to the nursing team. Option C. Implementing a mandatory preoperative assessment protocol that requires the standardized application of the ASA physical status classification system by qualified perioperative nursing staff, with documentation of the rationale for each classification. Option D. Developing a simplified checklist for risk assessment that focuses only on the patient's primary surgical diagnosis, without considering other comorbidities. The correct answer is C. Implementing a mandatory preoperative assessment protocol that requires the standardized application of the ASA physical status classification system by qualified perioperative nursing staff, with documentation of the rationale for each classification. Explanation. Scenario analysis. This scenario presents a common challenge in perioperative settings where the application of risk assessment tools, such as the ASA Physical Status Classification System, is crucial for patient safety and informed decision-making. The challenge lies in ensuring consistent and accurate application of the classification system across diverse patient populations and surgical procedures, while adhering to established professional standards and regulatory guidelines. Misapplication can lead to inadequate preoperative planning, inappropriate resource allocation, and potentially adverse patient outcomes. Professional judgment is required to interpret patient conditions within the framework of the ASA classification, recognizing that it is a guide and not an absolute determinant. Correct approach analysis. The correct approach involves a comprehensive preoperative assessment that utilizes the ASA Physical Status Classification System as a standardized tool to evaluate a patient's overall health status and comorbidities. This systematic evaluation allows for a more accurate prediction of perioperative risk and informs the development of a tailored anesthetic and surgical plan. Adherence to the ASA guidelines ensures a consistent and evidence-based approach to risk stratification, which is a fundamental principle of patient safety and quality care in perioperative nursing, aligning with the professional standards expected of CNOR certification. This approach directly supports the governance review's objective of ensuring robust risk assessment. Incorrect approaches analysis. One incorrect approach is to rely solely on the surgeon's initial assessment without a formal, standardized risk classification. This bypasses a critical step in preoperative evaluation, potentially overlooking significant patient factors that could impact perioperative outcomes. It fails to adhere to established best practices for risk assessment and can lead to inconsistencies in care. Another incorrect approach is to apply the ASA classification based on the surgical procedure alone, rather than the patient's individual physiological status. The ASA system is designed to classify the patient, not the surgery. This misapplication negates the purpose of the tool, which is to assess the patient's systemic health and its potential impact on their ability to tolerate anesthesia and surgery. A third incorrect approach is to use outdated or informal methods of risk assessment that are not aligned with current professional standards or regulatory expectations. This demonstrates a lack of commitment to evidence-based practice and can result in suboptimal patient care and increased risk. Professional reasoning. Perioperative nurses must employ a systematic decision-making process that prioritizes patient safety and adherence to professional standards. This involves 1. Understanding and consistently applying recognized risk assessment tools like the ASA Physical Status Classification System. 2. Conducting a thorough preoperative assessment that considers the patient's medical history, current health status, and comorbidities. 3. Collaborating with the anesthesia provider and surgical team to ensure accurate classification and appropriate risk mitigation strategies. 4. Documenting the risk assessment and the rationale for the chosen classification. 5. Staying current with professional guidelines and regulatory requirements related to patient safety and risk management. Question 6. Strategic planning requires a clear understanding of surgical procedure classifications to effectively allocate limited perioperative resources. When faced with a situation where operating room time is unexpectedly limited due to unforeseen circumstances, which of the following approaches best guides the prioritization of surgical cases to ensure optimal patient outcomes and adherence to professional standards? Option A. Prioritize cases based on a pre-established hierarchy of surgical urgency, starting with emergent procedures, followed by urgent, and then elective, involving the surgical team in the assessment of each case's acuity and the impact of any delay. Option B. Allow the surgeon with the longest waiting list for their elective cases to dictate the order of procedures, ensuring patient satisfaction for those who have been waiting the longest. Option C. Schedule the elective procedures first, as these are typically less complex and can be completed within a shorter time frame, thereby maximizing the number of cases performed. Option D. Postpone all non-emergent cases, including both urgent and elective procedures, until full operating room capacity is restored, regardless of the potential impact on patient conditions. The correct answer is A. Prioritize cases based on a pre-established hierarchy of surgical urgency, starting with emergent procedures, followed by urgent, and then elective, involving the surgical team in the assessment of each case's acuity and the impact of any delay. Explanation. The scenario presents a common challenge in perioperative settings, balancing patient needs with resource allocation when faced with different surgical urgency levels. The professional challenge lies in making timely and ethically sound decisions that prioritize patient safety and well-being, while adhering to established protocols and regulatory expectations for surgical scheduling and care. Careful judgment is required to differentiate between surgical urgency levels and to ensure that the appropriate resources are allocated to each patient based on their clinical condition. The correct approach represents best professional practice because it aligns with the fundamental ethical principle of beneficence and the regulatory framework governing healthcare, which mandates prioritizing care based on medical necessity. In the U.S., the Centers for Medicare and Medicaid Services, CMS, regulations and the Joint Commission standards emphasize patient safety and quality of care, implicitly supporting the prioritization of emergent and urgent procedures over elective ones when resources are constrained. This approach ensures that patients with life-threatening or limb-threatening conditions receive immediate attention, thereby minimizing potential harm and optimizing outcomes. It also reflects a commitment to equitable care delivery. An incorrect approach that prioritizes elective procedures over urgent ones when resources are limited would represent a significant regulatory and ethical failure. This would violate the principle of non-maleficence by potentially delaying care for a patient whose condition could worsen, leading to adverse outcomes. Ethically, it demonstrates a disregard for the hierarchy of medical need and could be seen as a failure to provide care in a just and equitable manner. From a regulatory standpoint, such a decision could lead to non-compliance with accreditation standards and potentially impact reimbursement if patient outcomes are negatively affected due to delayed care. Another incorrect approach that fails to involve the surgical team in the decision-making process regarding procedure prioritization would be professionally unacceptable. It bypasses essential collaborative practice, which is a cornerstone of safe perioperative care. Regulatory bodies like the Association of Perioperative Registered Nurses, AORN guidelines emphasize interdisciplinary communication and collaboration for optimal patient outcomes. Failing to involve the surgical team can lead to miscommunication, missed critical information, and ultimately compromised patient care. A further incorrect approach that relies solely on the surgeon's preference without considering the overall patient acuity and available resources would also be problematic. While surgeon input is vital, a holistic approach is necessary. This could lead to an inequitable distribution of resources and potentially delay care for patients with more critical needs, even if their surgeon is highly influential. This approach lacks the systematic evaluation required by healthcare institutions to ensure efficient and ethical resource management. The professional decision-making process for similar situations should involve a clear understanding of the definitions of elective, urgent, and emergent procedures. It requires a systematic assessment of patient acuity, a thorough understanding of available resources, staffing, equipment, operating room availability, and adherence to institutional policies and procedures for surgical scheduling and prioritization. Open communication and collaboration among the surgical team, nursing staff, and administration are crucial. When conflicts arise, a tiered approach to decision-making, often involving a designated clinical leader or committee, should be utilized to ensure that decisions are made based on objective clinical criteria and ethical principles, prioritizing patient safety and well-being above all else. Question 7. The evaluation methodology shows that a perioperative nurse is caring for a patient undergoing a surgical procedure requiring general anesthesia. The anesthesiologist has administered sevoflurane as the primary inhalational agent. Which of the following nursing actions best reflects an understanding of the pharmacology of sevoflurane and its implications for perioperative care? Option A. Ensuring the patient's airway is patent and that the anesthesia mask is securely fitted to prevent leakage of the anesthetic agent. Option B. Administering a prescribed opioid analgesic to manage postoperative pain, focusing on the patient's verbal reports of discomfort. Option C. Reviewing the patient's medical history for any previous adverse reactions to inhaled anesthetics and documenting the current anesthetic agent used. Option D. Monitoring the patient for signs of respiratory depression and hypotension, and being prepared to administer intravenous fluids or vasopressors as indicated by the anesthesiologist. Correct answer is D. Monitoring the patient for signs of respiratory depression and hypotension, and being prepared to administer intravenous fluids or vasopressors as indicated by the anesthesiologist. Explanation. The evaluation methodology shows that a perioperative nurse must possess a comprehensive understanding of anesthetic agents and their pharmacology to ensure patient safety and optimize care. This scenario is professionally challenging because the nurse is responsible for anticipating potential patient responses to different anesthetic agents, recognizing adverse reactions, and intervening appropriately, all within the dynamic environment of the operating room. Accurate knowledge of pharmacokinetics and pharmacodynamics is critical for this role. The correct approach represents best professional practice because it demonstrates a thorough understanding of the mechanisms of action, common side effects, and potential interactions of various anesthetic agents. This aligns with the core principles of perioperative nursing as outlined by professional organizations and regulatory bodies, which emphasize the nurse's role in patient assessment, monitoring, and the safe administration and management of medications. Adherence to evidence-based practice and established protocols is paramount. An incorrect approach that focuses solely on the route of administration, without considering the specific pharmacological properties of the agent, fails to meet professional standards. This oversight could lead to inadequate pain management, delayed recovery, or failure to recognize and manage adverse events, potentially violating patient safety guidelines and standards of care. Another incorrect approach that prioritizes patient comfort over understanding the underlying pharmacological principles of the anesthetic agent is also professionally unacceptable. While patient comfort is important, it should be achieved through informed interventions based on a sound understanding of the pharmacology, not through guesswork or superficial observation. This could result in inappropriate interventions or a lack of preparedness for serious complications. A third incorrect approach that relies on anecdotal evidence or the practices of other institutions without verifying their scientific basis or regulatory compliance is a significant ethical and professional failure. Perioperative nursing practice must be grounded in current scientific knowledge and regulatory requirements, ensuring that patient care is safe, effective, and consistent with established best practices. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly assessing the patient's baseline status and any comorbidities. Second, understanding the specific anesthetic agent being used, including its intended effects, potential side effects, and contraindications. Third, continuously monitoring the patient for expected and unexpected responses. And fourth, being prepared to implement appropriate interventions based on pharmacological principles and established protocols, always prioritizing patient safety and adhering to all relevant regulations and ethical guidelines. Question 8. Strategic planning requires a perioperative nurse to anticipate potential patient challenges. A patient scheduled for elective surgery expresses significant anxiety about postoperative breathing difficulties and requests to forego any invasive airway management, even if deemed medically necessary by the surgical team. The nurse recognizes the patient's right to refuse treatment, but also understands the potential respiratory risks associated with the planned procedure. What is the most ethically and professionally sound course of action for the perioperative nurse? Option A. Facilitate a comprehensive discussion between the patient, surgeon, and anesthesiologist to explore the patient's specific fears, educate them on the rationale for potential airway management, and collaboratively develop a plan that respects their autonomy while mitigating risks. Option B. Advocate for the patient's immediate request to forego all airway management, prioritizing their expressed wish above all other medical considerations to avoid potential conflict. Option C. Document the patient's request and proceed with standard perioperative care, assuming the surgical team will address any emergent airway issues during the procedure. Option D. Inform the patient that their request cannot be accommodated due to the potential for serious respiratory complications, and that the surgery may be postponed if they do not agree to all recommended interventions. The correct answer is A. Facilitate a comprehensive discussion between the patient, surgeon, and anesthesiologist to explore the patient's specific fears, educate them on the rationale for potential airway management, and collaboratively develop a plan that respects their autonomy while mitigating risks. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best medical interest of the patient, particularly when those wishes might lead to suboptimal respiratory outcomes in the perioperative period. The perioperative nurse must navigate this ethical tightrope, balancing patient autonomy with the professional obligation to provide safe and effective care, all within the framework of established nursing practice standards and patient rights. The correct approach represents best professional practice because it prioritizes open communication, patient education, and collaborative decision-making. By engaging in a thorough discussion with the patient and the surgical team, the nurse ensures that the patient's concerns are heard and addressed, while also providing them with the necessary information to make an informed decision. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, honoring the patient's right to self-determination. Furthermore, it adheres to professional nursing standards that mandate clear communication and patient advocacy. An incorrect approach that involves overriding the patient's stated preference without adequate discussion or justification would represent a failure to respect patient autonomy. This could lead to a breach of ethical principles and potentially violate patient rights. Another incorrect approach, such as proceeding with the surgery without fully understanding the patient's rationale or exploring alternatives, demonstrates a lack of thorough assessment and communication, which are fundamental to safe perioperative care. Failing to involve the surgical team in addressing the patient's concerns would also be a professional failing, as collaborative care is essential for optimal patient outcomes. The professional decision-making process for similar situations should involve a systematic approach. First, identify the ethical dilemma and the competing values. Second, gather all relevant information, including the patient's history, current condition, expressed wishes, and the medical team's recommendations. Third, engage in open and honest communication with the patient, explaining the risks and benefits of different options in a clear and understandable manner. Fourth, involve the interdisciplinary team to explore all possible solutions and ensure a coordinated approach. Finally, document the entire process and the final decision, ensuring it aligns with ethical principles and professional standards. Question 9. Assessment of a patient's readiness and ability to comprehend post-operative pain management strategies, including the use of prescribed analgesics and non-pharmacological comfort measures, is best achieved by Option A. Distributing a standardized pamphlet on pain management and assuming the patient will read and understand its contents. Option B. Delegating all pain management education to the surgeon and anesthesiologist, as they are the primary prescribers. Option C. Providing a detailed explanation of all available pain medications and their mechanisms of action, without inquiring about the patient's prior knowledge or preferences. Option D. Conducting a teach-back session where the patient explains the pain management plan in their own words after the nurse has provided information. The correct answer is D. Conducting a teach-back session where the patient explains the pain management plan in their own words after the nurse has provided information. Explanation. Scenario analysis. This scenario is professionally challenging because effective patient education on pain management is crucial for post-operative recovery, patient satisfaction, and preventing complications like chronic pain. The perioperative nurse must navigate individual patient needs, varying levels of health literacy, and the complex pharmacological and non-pharmacological interventions available, all while adhering to established standards of care and patient rights. Ensuring the patient understands their pain management plan, potential side effects, and when to seek further assistance is paramount. Correct approach analysis. The correct approach involves a comprehensive, individualized, and interactive educational process. This aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes the nurse's responsibility to advocate for the patient and provide accurate, understandable information. Furthermore, it aligns with the standards of perioperative nursing practice, which mandate patient education as a core component of care. This approach respects the patient's autonomy by empowering them with knowledge to actively participate in their pain management, leading to better outcomes and adherence to the treatment plan. It also addresses potential barriers to understanding by using clear language and assessing comprehension. Incorrect approach is analysis, providing a generic, pre-printed handout without assessing the patient's understanding or ability to comprehend the material fails to meet the ethical obligation of providing individualized care and violates the principle of patient advocacy. It assumes a level of literacy and comprehension that may not exist, potentially leading to misunderstandings and ineffective pain management. This approach also neglects the nurse's responsibility to ensure the patient has the necessary information to make informed decisions about their care. Relying solely on the surgeon or anesthesiologist to provide all pain management education is a failure to uphold the nurse's scope of practice and collaborative responsibilities. While these providers have crucial roles, the perioperative nurse is uniquely positioned to reinforce and clarify information, assess patient understanding in the context of their immediate post-operative experience, and address concerns that may arise. This abdication of responsibility can lead to fragmented care and gaps in patient knowledge. Focusing exclusively on pharmacological interventions and neglecting non-pharmacological strategies overlooks the holistic nature of pain management and the patient's potential preferences or needs for complementary therapies. Effective pain management often involves a multimodal approach, and failing to educate on all available options limits the patient's choices and potentially their ability to achieve optimal pain relief. This also fails to address the ANA Code of Ethics' emphasis on promoting health and well-being through comprehensive care. Professional reasoning. Professionals should approach patient education on pain management by first assessing the patient's current knowledge, beliefs, and readiness to learn. This assessment should consider their health literacy, cultural background, and any potential barriers to understanding. Next, the nurse should develop a personalized education plan, utilizing clear, concise language and appropriate teaching methods, e.g., verbal explanation, demonstration, visual aids. The plan should cover the rationale for pain management, types of interventions, pharmacological and non-pharmacological, expected outcomes, potential side effects and their management, and when to seek assistance. Crucially, the nurse must actively assess for understanding through teach-back methods and provide opportunities for questions. This iterative process ensures that education is effective, patient-centered, and compliant with professional and ethical standards. Question 10. Comparative studies suggest that a comprehensive preoperative risk assessment is crucial for managing patients with potential renal and urinary system compromise during surgery. Which of the following approaches best reflects a proactive and evidence-based strategy for identifying and mitigating these risks in the perioperative setting? Option A. Focusing exclusively on maintaining adequate intraoperative fluid balance without considering the patient's individual renal reserve or the specific surgical context. Option B. Prioritizing a detailed review of the patient's baseline renal function, current medications, and any history of urinary tract issues, alongside an analysis of the planned surgical procedure and anesthetic agents for potential nephrotoxic effects or hemodynamic instability. Option C. Relying primarily on post-operative urine output measurements to detect any signs of renal dysfunction after the surgical intervention is completed. Option D. Considering pre-existing renal conditions as a low-priority factor unless they are severe, assuming that healthy kidneys can generally withstand surgical stress. The correct answer is B. Prioritizing a detailed review of the patient's baseline renal function, current medications, and any history of urinary tract issues, alongside an analysis of the planned surgical procedure and anesthetic agents for potential nephrotoxic effects or hemodynamic instability. Explanation. This scenario is professionally challenging because the perioperative nurse must anticipate and mitigate potential renal and urinary system complications in a patient undergoing surgery, where physiological changes can significantly impact kidney function. Accurate risk assessment requires a comprehensive understanding of pre-existing conditions, surgical factors, and anesthetic agents, all within the framework of patient safety and evidence-based practice. The correct approach represents best professional practice because it involves a proactive and systematic evaluation of patient-specific factors that could predispose them to renal compromise. This aligns with the CNOR commitment to patient safety and the ethical imperative to provide individualized care. By identifying potential risks early, the nurse can implement targeted interventions, monitor renal function closely, and collaborate effectively with the surgical and anesthesia teams to minimize adverse outcomes. This proactive risk assessment is a cornerstone of safe perioperative nursing practice, directly supporting the principles of patient advocacy and the prevention of harm, as emphasized in professional nursing standards and guidelines. An incorrect approach that relies solely on post-operative assessment fails to meet professional standards. It represents a reactive rather than a proactive stance, potentially delaying crucial interventions and increasing the risk of irreversible renal damage. This approach neglects the ethical obligation to anticipate and prevent harm, which is a fundamental aspect of nursing care. Furthermore, it may violate guidelines that mandate comprehensive preoperative assessment and risk stratification. Another incorrect approach that focuses only on intraoperative fluid administration without considering the patient's baseline renal status or the specific surgical context is also professionally unacceptable. A fluid management is critical. An unadjusted approach can lead to fluid overload or underperfusion, both of which can negatively impact renal function. This demonstrates a lack of critical thinking and individualized care planning, failing to adhere to the principle of tailoring interventions to the patient's unique physiological needs and surgical situation. A third incorrect approach that dismisses the significance of pre-existing renal conditions as a minor factor overlooks a critical determinant of perioperative risk. Ignoring or downplaying known comorbidities directly contradicts the ethical duty to provide thorough and informed care. It suggests a failure to appreciate the complex interplay between pre-existing conditions and surgical stress, potentially leading to inadequate preparation and management, and thus violating the principle of beneficence. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive preoperative assessment. Thoroughly review the patient's medical history, including any pre-existing renal conditions, medications, and laboratory values. 2. Risk identification. Identify specific surgical and anesthetic factors that may impact renal function, e.g., duration of surgery, blood loss, use of nephrotoxic agents, hypotension. 3. Collaborative planning. Discuss identified risks with the surgical and anesthesia teams to develop a tailored perioperative plan. 4. Intraoperative monitoring. Closely monitor vital signs, urine output, and other relevant parameters. 5. Postoperative evaluation. Continue to assess renal function and implement appropriate interventions as needed. 6. Documentation. Meticulously document all assessments, interventions, and patient responses. Question 11. The audit findings indicate a deviation from the standardized protocol for surgical site marking, specifically concerning the verification of the correct surgical site by the entire surgical team prior to the initial incision. Which of the following actions best addresses this finding to ensure immediate patient safety and regulatory compliance? Option A. Immediately implement a mandatory timeout procedure for site verification involving all members of the surgical team, including the surgeon, anesthesia provider, and nursing staff, before any invasive procedure begins. Option B. Instruct the scrub nurse to verbally confirm the site marking with the circulating nurse before the surgeon enters the room. Option C. Document the finding in the audit report and schedule a follow-up meeting with the surgical team in 1 week to discuss the importance of site marking. Option D. Advise the surgeon to be more diligent in their personal site marking and verification process during the preoperative assessment. The correct answer is A. Immediately implement a mandatory timeout procedure for site verification involving all members of the surgical team, including the surgeon, anesthesia provider, and nursing staff, before any invasive procedure begins. Explanation. The audit findings indicate a potential lapse in adherence to established patient safety protocols within the perioperative setting. This scenario is professionally challenging because it requires immediate and decisive action to rectify the identified issue, safeguarding patient well-being, while also ensuring compliance with regulatory standards. The perioperative nurse must exercise careful judgment to select the most appropriate intervention that aligns with best practices and legal requirements. The correct approach represents best professional practice because it directly addresses the identified safety concern by implementing a universally recognized and evidence-based protocol designed to prevent patient harm. This aligns with the fundamental ethical obligation of the perioperative nurse to advocate for patient safety and uphold the standards of care established by professional organizations and regulatory bodies governing perioperative nursing in the United States. Specifically, this approach would be supported by guidelines from organizations such as the Association of Perioperative Registered Nurses, AORN, and potentially by Joint Commission standards related to patient safety and infection control. An incorrect approach that fails to implement the necessary safety measure would represent a significant regulatory and ethical failure. This could lead to adverse patient outcomes, such as surgical site infections or retained surgical items, which are preventable events. Ethically, it violates the principle of non-maleficence, do no harm, and beneficence, act in the patient's best interest. From a regulatory standpoint, it could result in citations, sanctions, and legal repercussions for the individual nurse and the healthcare facility, failing to meet the standards mandated by bodies like the Centers for Medicare and Medicaid Services, CMS, or state boards of nursing. Another incorrect approach that involves a superficial or delayed response would also be professionally unacceptable. Patient safety cannot be compromised by administrative delays or a lack of urgency. This demonstrates a failure to prioritize patient well-being and a disregard for the critical nature of perioperative safety protocols. The professional reasoning process for similar situations should involve a systematic evaluation of the audit findings, immediate consultation with relevant policies and procedures, and a clear understanding of the potential risks to the patient. Nurses should be empowered to identify and address safety concerns proactively, escalating issues when necessary and advocating for the implementation of evidence-based practices. This decision-making process is guided by a commitment to patient advocacy, adherence to professional standards, and a thorough knowledge of regulatory requirements. Question 12. To address the challenge of a surgeon requesting a modification to a standard surgical instrument count procedure mid-case due to time constraints, which of the following represents the most appropriate perioperative nursing fundamental approach to ensure patient safety and regulatory compliance? Option A. Engage in a direct conversation with the surgeon and anesthesiologist to understand the rationale for the modification, discuss potential risks, and collaboratively determine the safest approach to instrument counts within established guidelines. Option B. Document the surgeon's request for a modified count without further action, assuming the surgeon is aware of the implications. Option C. Politely but firmly refuse the modification, citing standard protocol, and insist on the complete standard count procedure. Option D. Immediately proceed with the modified count, as requested by the surgeon, to maintain the surgical schedule. Correct answer is D. Immediately proceed with the modified count as requested by the surgeon to maintain the surgical schedule. Explanation. The scenario presents a common challenge in perioperative nursing, ensuring patient safety and adherence to established protocols when faced with a deviation from the standard procedure. The professional challenge lies in balancing the need for efficient patient care with the imperative to maintain the highest standards of safety and quality, as mandated by regulatory bodies and professional standards. Careful judgment is required to assess the immediate risk, the rationale for the deviation, and the potential impact on patient outcomes. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care. It involves a systematic process of assessment, communication, and documentation. By consulting with the surgeon and anesthesiologist, the nurse ensures that any deviation is understood, justified, and that appropriate measures are in place to mitigate risks. This aligns with the core principles of perioperative nursing, which emphasize patient advocacy, collaboration, and adherence to established safety protocols. The Association of Perioperative Registered Nurses, AORN, guidelines for perioperative practice, which are foundational for CNOR certification, strongly advocate for such a collaborative and safety-focused approach. An incorrect approach that involves proceeding without clear understanding or documentation of the deviation fails to uphold the nurse's responsibility as a patient advocate and a guardian of safety. This could lead to compromised patient care, increased risk of adverse events, and potential legal or ethical ramifications. Specifically, failing to communicate with the surgical team about a deviation from the sterile field or a change in a planned procedure violates the fundamental principle of teamwork and communication, essential for patient safety in the operating room. Such an action could also be considered a breach of professional conduct and a failure to adhere to institutional policies and AORN guidelines, which emphasize the importance of a sterile environment and clear communication channels. Another incorrect approach, such as unilaterally altering the procedure without consultation, demonstrates a lack of respect for the established surgical plan and the expertise of the surgical team. This bypasses critical decision-making processes and can lead to unforeseen complications. Ethically, this is a failure of professional responsibility and a disregard for the collaborative nature of surgical care. The professional reasoning process for similar situations should involve a clear step-by-step approach. 1. Identify the deviation from the expected standard or plan. 2. Assess the immediate patient safety implications of the deviation. 3. Communicate the observation and concerns clearly and concisely to the responsible parties, e.g., surgeon, anesthesiologist. 4. Seek clarification and understand the rationale for the deviation. 5. Collaborate with the team to determine the safest course of action and any necessary modifications to care. 6. Document all observations, communications, and decisions thoroughly. 7. Escalate concerns if patient safety remains compromised or if the deviation is not adequately addressed. Question 13. The assessment process reveals a 78-year-old patient with a history of hypertension, diabetes, and mild renal insufficiency scheduled for a total hip arthroplasty. The patient also reports recent onset of shortness of breath and occasional palpitations. Which of the following approaches best addresses the perioperative risk assessment for this patient? Option A. Prioritize the patient's reported shortness of breath and palpitation, initiating immediate cardiac workup and delaying the surgical assessment until all cardiac issues are fully resolved. Option B. Focus primarily on the orthopedic surgical procedure itself, assuming that standard protocols for total hip arthroplasty will adequately manage any potential complications given the patient's age. Option C. Conduct a comprehensive review of the patient's medical history, current medications, and recent symptoms, collaborating with the surgical and anesthesia teams to identify specific risks related to orthopedic surgery and the patient's comorbidities, and develop a tailored perioperative plan. Option D. Rely on the surgeon's initial assessment and assume that any significant risks will be identified and managed by the anesthesia team during the intraoperative period. Correct answer is C. Conduct a comprehensive review of the patient's medical history, current medications, and recent symptoms, collaborating with the surgical and anesthesia teams to identify specific risks related to orthopedic surgery and the patient's comorbidities, and develop a tailored perioperative plan. Explanation. The assessment process reveals a patient with multiple comorbidities undergoing a complex orthopedic procedure. This scenario is professionally challenging due to the inherent risks associated with orthopedic surgery, amplified by the patient's underlying health conditions. A comprehensive risk assessment is paramount to identify potential complications, tailor the perioperative plan, and ensure patient safety, aligning with the CNOR exam's emphasis on evidence-based practice and patient advocacy within the U.S. regulatory framework governing healthcare. The correct approach involves a systematic, multidisciplinary risk assessment that prioritizes patient-specific factors and potential surgical complications. This aligns with the Joint Commission Standards for Patient Safety and the American Nurses Association (ANA) Code of Ethics, which mandate nurses to advocate for patients and provide care based on the best available evidence. A thorough assessment allows for proactive intervention, such as optimizing the patient's condition preoperatively, selecting appropriate surgical techniques, and planning for potential postoperative needs, thereby minimizing adverse outcomes. An incorrect approach that focuses solely on the surgical procedure without adequately considering the patient's comorbidities fails to meet the standard of care. This oversight could lead to preventable complications, violating the nurse's ethical obligation to provide individualized care and potentially breaching facility policies that mandate comprehensive patient assessments. Another incorrect approach, which relies on assumptions based on previous similar cases without a current, individualized assessment, disregards the dynamic nature of patient health and the unique risks presented by each individual. This can lead to missed critical information and inadequate preparation, contravening the principles of patient-centered care and evidence-based practice. A third incorrect approach, which delegates the primary risk assessment responsibility entirely to another discipline without active nursing participation and critical evaluation, undermines the nurse's role as a key member of the perioperative team and a patient advocate, potentially leading to a fragmented and less effective care plan. Professionals should employ a decision-making framework that begins with a thorough review of the patient's medical history, current status, and the proposed surgical intervention. This should be followed by a collaborative assessment involving the surgeon, anesthesiologist, and other relevant healthcare providers. The nurse's role is to synthesize this information, identify potential risks, and contribute to the development of a comprehensive, individualized perioperative plan that addresses these risks proactively. Continuous reevaluation throughout the perioperative period is also essential. Question 14. System analysis indicates a patient scheduled for elective surgery has a documented history of a myocardial infarction 5 years ago. The patient reports no current chest pain or shortness of breath. The perioperative nurse is reviewing the patient's chart prior to transport to the operating room. What is the most appropriate immediate action for the perioperative nurse to take? Option A. Proceed with transporting the patient to the operating room as scheduled, assuming the patient's current asymptomatic status indicates no immediate risk. Option B. Consult with the anesthesia provider to discuss the patient's cardiac history and its potential implications for the planned procedure. Option C. Delay the surgery indefinitely until a new cardiac workup can be completed. Option D. Inform the surgeon that the surgery must be postponed due to the patient's past cardiac event. The correct answer is B. Consult with the anesthesia provider to discuss the patient's cardiac history and its potential implications for the planned procedure. Explanation. Scenario analysis. This scenario presents a common challenge in perioperative nursing. A patient with a history of a significant medical condition that could impact their perioperative course, but who may not have had recent comprehensive assessment or clear communication regarding its current status. The challenge lies in balancing the need for timely surgical intervention with the imperative to ensure patient safety by thoroughly understanding and mitigating potential risks. The perioperative nurse must exercise critical judgment to determine the most appropriate next steps without causing undue delay or compromising care. Correct approach analysis. The correct approach prioritizes obtaining current, relevant clinical data directly related to the patient's known risk factor. Consulting with the anesthesia provider is crucial because they are responsible for the patient's physiological management throughout the perioperative period and are best equipped to assess the implications of the patient's cardiac history on anesthetic choices and intraoperative monitoring. This collaborative step ensures that any potential risks are identified and managed proactively, aligning with the principles of patient safety and evidence-based practice mandated by professional nursing standards and regulatory bodies governing perioperative care in the U.S. This approach directly addresses the potential impact of the cardiac history on the patient's immediate perioperative safety. Incorrect approaches analysis. Proceeding with the surgery without further assessment or consultation fails to uphold the nurse's ethical and professional responsibility to advocate for patient safety. This bypasses established protocols for risk assessment and management, potentially violating standards of care and leading to adverse patient outcomes. Demonstrates a failure to recognize and act upon a known risk factor. Delaying the surgery indefinitely based solely on a past diagnosis without current assessment is also inappropriate. While caution is warranted, a definitive decision to postpone requires a thorough understanding of the patient's current physiological status and the specific risks associated with the planned procedure. This approach lacks the necessary clinical data to justify such a significant intervention. Relying solely on the surgeon's initial assessment without involving the anesthesia provider overlooks the critical role of anesthesia in managing perioperative physiological stability. The surgeon's focus is primarily on the operative procedure, while anesthesia addresses the patient's overall response to surgery and anesthesia. This division of responsibility necessitates collaboration to ensure comprehensive patient care. Professional reasoning. Perioperative nurses must employ a systematic approach to patient assessment. This involves reviewing the patient's history, identifying potential risk factors, and then gathering current, relevant data. When a significant risk factor is present, such as a history of myocardial infarction, the professional decision-making process dictates that the nurse should collaborate with the interdisciplinary team, particularly anesthesia and surgery, to assess the patient's current status and determine the safest course of action. This involves asking critical questions. Is the patient currently symptomatic? What is their functional capacity? What are the specific anesthetic and surgical risks? This collaborative, data-driven approach ensures that patient care is individualized, safe, and compliant with professional standards. Question 15. The risk matrix shows a statistically lower incidence of surgical site infections and a shorter hospital stay for minimally invasive surgery, MIS, compared to open surgery for a specific abdominal procedure. A patient with a history of multiple abdominal surgeries and significant adhesions is being considered for this procedure. The perioperative nurse is reviewing the preoperative assessment and the risk matrix data. Which of the following represents the most appropriate nursing action in this situation? Option A. Recommend proceeding with open surgery, as the patient's history of adhesions inherently increases the risk of complications with minimally invasive techniques, overriding the general risk matrix data. Option B. Advocate for the patient to undergo minimally invasive surgery, emphasizing the lower infection rates and shorter hospital stay as indicated by the risk matrix. Option C. Inform the patient that minimally invasive surgery is the preferred option due to its generally lower complication rates, as presented in the risk matrix. Option D. Discuss the risk matrix findings with the surgical team, highlighting the patient's complex surgical history and potential challenges for minimally invasive approaches, and collaborate on the optimal surgical strategy. The correct answer is B. Advocate for the patient to undergo minimally invasive surgery, emphasizing the lower infection rates and shorter hospital stay as indicated by the risk matrix. Explanation. This scenario presents a professional challenge due to the inherent complexities of patient care decision-making, balancing patient outcomes, resource allocation, and evolving surgical techniques. The perioperative nurse must critically evaluate the information presented in the risk matrix and apply it to the specific patient's needs and the available resources, adhering to established professional standards and guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's suitability for minimally invasive surgery, MIS, versus open surgery. This aligns with the ethical principle of beneficence, ensuring the patient receives the most appropriate and beneficial treatment. It also adheres to professional nursing standards that mandate evidence-based practice and patient advocacy. By considering the patient's specific comorbidities, surgeon's expertise, and available technology, the nurse ensures that the chosen surgical approach is not only technically feasible, but also minimizes potential risks and maximizes the likelihood of a positive outcome. In line with the principles of patient-centered care and the American Nurses Association, ANA, Code of Ethics, an incorrect approach that solely focuses on the perceived lower risk of infection associated with MIS without a thorough patient-specific evaluation fails to uphold the principle of non-maleficence. While MIS generally has a lower infection risk, it may not be suitable for all patients, and forcing its use could lead to complications or suboptimal outcomes. This approach also disregards the surgeon's expertise and the specific nuances of the procedure, potentially leading to a technically challenging surgery and increased patient risk. Another incorrect approach that prioritizes cost savings by defaulting to MIS, regardless of patient suitability, violates the ethical obligation to prioritize patient well-being over financial considerations. While cost-effectiveness is a factor in healthcare, it must never supersede the patient's safety and optimal treatment. This approach could lead to increased complications, longer hospital stays, and ultimately higher costs if the MIS is not appropriate. A further incorrect approach that relies solely on the surgeon's preference without independent nursing assessment or consideration of the patient's unique factors neglects the nurse's role as a patient advocate and a critical member of the interdisciplinary team. While surgeon expertise is vital, the nurse's role includes ensuring all aspects of patient care are considered, including patient preferences, potential risks and benefits from a holistic perspective, and the availability of necessary support. Professional decision-making in such situations requires a systematic approach. 1. Thoroughly assess the patient's medical history, comorbidities, and current condition. 2. Review the evidence supporting MIS versus open surgery for the specific procedure and patient population. 3. Consult with the surgical team to understand their expertise and the feasibility of each approach. 4. Discuss the risks, benefits, and alternatives with the patient and their family, ensuring informed consent. 5. Advocate for the approach that best aligns with the patient's individual needs and promotes the safest and most effective outcome, in accordance with professional nursing standards and ethical guidelines. Question 16. Consider a scenario where during a complex surgical procedure, the perioperative nurse observes the surgeon's glove brush against a non-sterile surface. The nurse is certain of the observation, but the surgeon appears unaware of the potential contamination. What is the most appropriate immediate action for the perioperative nurse to take? Option A. Loudly announce the perceived breach of sterile technique to alert the entire surgical team. Option B. Discreetly and immediately inform the surgeon of the observation in a calm and professional manner. Option C. Continue to monitor the situation without intervening, assuming the surgeon is aware and will manage it. Option D. Make a note of the observation to report to the charge nurse after the procedure is completed. The correct answer is B. Discreetly and immediately inform the surgeon of the observation in a calm and professional manner. Explanation. Scenario analysis. This scenario presents a common but challenging situation in perioperative nursing, where a nurse must balance patient advocacy, adherence to established protocols, and effective communication with the surgical team. The challenge lies in identifying and addressing a potential breach of sterile technique without causing undue disruption or undermining the surgeon's authority, while ensuring patient safety remains paramount. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety through vigilant observation and timely, respectful intervention. The perioperative nurse has a primary responsibility to maintain a sterile environment to prevent surgical site infections, as mandated by standards of care and professional nursing practice guidelines. By immediately and discreetly addressing the potential break in sterile technique, the nurse upholds their ethical obligation to the patient and adheres to established infection control protocols. This action is consistent with the Association of Perioperative Registered Nurses, AORN guidelines for perioperative practice, which emphasize the nurse's role in identifying and mitigating risks to patient safety. Incorrect approaches analysis. One incorrect approach involves ignoring the observation. This failure constitutes a significant breach of professional responsibility and violates the fundamental ethical principle of non-maleficence, do no harm. It directly contravenes AORN guidelines and general principles of infection control, potentially leading to a surgical site infection, increased patient morbidity, and prolonged recovery. Another incorrect approach is to loudly announce the perceived breach. While the intention may be to correct the situation, this method is unprofessional and disruptive. It can create unnecessary tension, undermine team cohesion, and potentially embarrass the surgeon, hindering effective communication. Professional practice dictates that such issues be addressed discreetly to maintain a collaborative and respectful surgical environment, as advocated by principles of teamwork and communication in healthcare. A third incorrect approach is to wait until after the procedure to report the observation. This delays necessary corrective action, leaving the patient at risk of infection for the remainder of the surgery. It also misses the opportunity for immediate correction and education, which is crucial for preventing future breaches. This approach fails to meet the standard of immediate intervention required for maintaining sterile integrity. Professional reasoning. Professionals should employ a systematic approach to patient safety. This involves continuous environmental scanning, critical assessment of observed events, and a clear understanding of their role in maintaining sterile fields. When a potential breach is identified, the decision-making process should prioritize immediate, discreet, and respectful communication with the responsible individual. If the issue is not resolved appropriately, escalation to a charge nurse or surgical supervisor, following established facility protocols, is the next step. This process ensures patient safety is addressed effectively while maintaining professional decorum and team collaboration. Question 17. The investigation demonstrates a perioperative nurse reviewing a patient's chart prior to a scheduled orthopedic procedure. The patient is a healthy 45-year-old male with no known allergies and a mild preference for avoiding general anesthesia if possible. The procedure involves a knee arthroscopy. Which of the following anesthetic approaches, when considered in isolation, best reflects a comprehensive and patient-centered decision-making process aligned with perioperative nursing standards? Option A. Suggesting local infiltration anesthesia, as it is the least invasive option and can be performed by the surgeon without the need for an anesthesiologist. Option B. Advocating for general anesthesia, as it guarantees complete patient immobility and unconsciousness, simplifying surgical management for all orthopedic procedures. Option C. Prioritizing a peripheral nerve block, as it provides targeted analgesia to the surgical site with minimal systemic absorption and allows for early ambulation postoperatively. Option D, recommending a spinal anesthetic, as it offers excellent analgesia for lower extremity procedures and allows the patient to remain awake if desired, minimizing systemic effects. The correct answer is D, recommending a spinal anesthetic, as it offers excellent analgesia for lower extremity procedures and allows the patient to remain awake if desired, minimizing systemic effects. Explanation: scenario analysis. This scenario is professionally challenging because it requires the perioperative nurse to critically evaluate the suitability of different anesthetic techniques based on patient-specific factors and the surgical procedure, while adhering to established standards of care and patient safety protocols. The nurse must possess a comprehensive understanding of the implications of each anesthetic type for patient outcomes, potential complications, and the perioperative environment. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and optimal surgical outcomes by selecting the anesthetic that best aligns with the patient's physiological status, the invasiveness of the procedure, and the surgeon's requirements. This involves a thorough pre-anesthetic assessment, consideration of patient comorbidities, and an understanding of the pharmacodynamics and pharmacokinetics of various anesthetic agents. Adherence to the Association of Perioperative Registered Nurses, AORN, guidelines for evidence-based practice, which emphasize patient assessment and the selection of appropriate interventions, is paramount. This approach ensures that the chosen anesthetic minimizes risks such as respiratory depression, cardiovascular instability, or nerve damage, and facilitates effective pain management throughout the perioperative period. Incorrect approach is analysis. An approach that exclusively favors general anesthesia for all procedures, regardless of patient suitability or procedural complexity, fails to acknowledge the benefits of regional or local anesthesia in reducing systemic side effects, promoting faster recovery, and potentially lowering the risk of certain complications. This can be considered a failure to adhere to the principle of individualized patient care and may violate AORN guidelines that advocate for the least invasive effective intervention. An approach that prioritizes regional anesthesia for all patients, even those with contraindications such as coagulopathies or severe needle phobias, demonstrates a disregard for patient safety and contraindications. This could lead to serious complications like hematoma formation, nerve injury, or profound patient distress, violating ethical obligations who do no harm and potentially contravening specific institutional policies and AORN recommendations regarding patient assessment and risk mitigation. An approach that solely relies on local anesthesia for extensive or deeply invasive procedures, without considering the limitations in patient comfort, surgical field control, and potential for systemic absorption of local anesthetics, is also professionally unacceptable. This can result in inadequate pain control, patient movement during surgery, and potential systemic toxicity, failing to meet the standards of care for effective perioperative management and patient well-being as outlined by professional nursing organizations. Professional reasoning. Perioperative nurses should employ a systematic decision-making process that begins with a comprehensive pre-anesthetic assessment. This includes reviewing the patient's medical history, current medications, allergies, and any specific anxieties or preferences. The nurse must then consider the nature and duration of the surgical procedure, the expected level of pain, and the potential for complications. Collaboration with the anesthesiologist and surgeon is crucial to determine the most appropriate anesthetic technique. This collaborative approach ensures that all relevant factors are considered, leading to a safe and effective anesthetic plan that aligns with evidence-based practice and ethical principles. Question 18. Upon reviewing the surgical site during a procedure, the perioperative nurse observes what appears to be an unusual amount of bleeding from a specific vessel that was not directly manipulated by the surgeon. The surgeon has not commented on the bleeding. What is the most appropriate immediate action for the perioperative nurse to take? Option A. Discreetly alert the surgeon to the observed increased bleeding, specifying the location, and inquire if this is expected or requires attention. Option B. Document the observation in the patient's chart without informing the surgical team at that moment. Option C. Immediately request a different surgical assistant to manage the bleeding. Option D. Continue to assist the surgeon as usual, assuming the surgeon is aware and managing the situation appropriately. The correct answer is A. Discreetly alert the surgeon to the observed increased bleeding, specifying the location, and inquire if this is expected or requires attention. Explanation. The scenario presents a common challenge in perioperative nursing, balancing patient advocacy with physician directives when a potential safety concern arises. The perioperative nurse's role is multifaceted, encompassing direct patient care, safety monitoring, and communication. This situation requires the nurse to exercise critical judgment, drawing upon their knowledge of patient anatomy, surgical procedure, and established safety protocols to ensure the patient's well-being. The correct approach prioritizes patient safety and adheres to the fundamental ethical and professional responsibilities of a perioperative nurse. It involves a systematic and collaborative process of assessment, communication, and intervention. By first assessing the situation objectively and then communicating concerns to the surgeon in a clear and professional manner, the nurse acts as a patient advocate. This aligns with the core principles of nursing practice, which emphasize patient advocacy, ethical conduct, and the nurse's responsibility to report and address potential risks. The CNOR certification underscores the expectation that perioperative nurses possess the knowledge and skills to navigate such complex situations, ensuring adherence to best practices and patient safety standards. An incorrect approach that involves immediately proceeding without further inquiry disregards the nurse's professional obligation to assess and question potentially unsafe practices. This could lead to patient harm and violates the ethical principle of non-maleficence. Another incorrect approach, such as directly contradicting the surgeon without a clear, objective assessment or established protocol violation, could undermine the surgical team's dynamic and may not be the most effective way to address the concern, potentially escalating conflict rather than resolving it. Furthermore, delaying reporting or failing to document the concern represents a significant ethical and professional lapse, potentially compromising patient care and legal accountability. Professional decision-making process in such situations should involve 1. Objective assessment of the situation, 2. Identification of potential risks to the patient, 3. Consultation of relevant policies, procedures, and evidence-based practice guidelines, 4. Clear and concise communication of concerns to the appropriate team member, in this case, the surgeon, 5. Collaborative problem solving, and 6. Documentation of all actions and communication. This structured approach ensures that patient safety remains paramount while fostering a respectful and effective team environment. Question 19. Operational review demonstrates that a perioperative nurse is assigned to assist in a neurosurgery case, a specialty they have limited prior experience in. Which of the following actions best reflects the nurse's professional responsibility and adherence to regulatory guidelines for ensuring patient safety in this context? Option A. Proceed with the case using only the information readily available in the immediate surgical environment, assuming the surgical team will provide necessary guidance as the procedure unfolds. Option B. Delegate tasks related to specialized neurosurgical instruments and equipment to more experienced team members without seeking to understand their function or proper use. Option C. Rely on general surgical knowledge and experience gained from other specialties, assuming the fundamental principles of sterile technique and instrument handling are universally applicable. Option D. Proactively consult with the neurosurgical team. Review relevant surgical protocols and instrumentation specific to neurosurgery, and seek clarification on any unfamiliar aspects of the procedure prior to and during the case. The correct answer is D. Proactively consult with the neurosurgical team, review relevant surgical protocols and instrumentation specific to neurosurgery, and seek clarification on any unfamiliar aspects of the procedure prior to and during the case. Explanation. The scenario presents a common challenge in perioperative nursing, ensuring consistent, high-quality care across diverse surgical specialties while adhering to established professional standards and regulatory guidelines. The challenge lies in the inherent variability of surgical procedures, patient populations, and the specific equipment and instrumentation required for each specialty. A perioperative nurse must possess a broad knowledge base and the ability to adapt their practice to meet the unique demands of each surgical area. This requires a commitment to continuous learning, meticulous attention to detail, and a proactive approach to identifying and mitigating potential risks. The correct approach emphasizes the nurse's responsibility to actively seek out and integrate specialty-specific knowledge and best practices. This aligns with the core principles of professional nursing practice, which mandate that nurses practice within their scope and competence, continuously strive for professional development, and advocate for patient safety. Regulatory frameworks, such as those governing nursing licensure and professional conduct, implicitly require nurses to maintain current knowledge and skills relevant to their practice areas. Ethically, this approach upholds the principle of beneficence by ensuring patients receive care that is informed by the most up-to-date and effective practices for their specific surgical needs. Incorrect approaches fail to meet these professional and regulatory expectations. One incorrect approach demonstrates a lack of commitment to ongoing learning and adaptation, which can lead to suboptimal patient care and increased risk of adverse events. Failure to update knowledge and skills violates the implicit expectation of professional competence and can be seen as a breach of the nurse's duty of care. Another incorrect approach shows a disregard for established protocols and evidence-based practices, prioritizing personal preference or convenience over patient safety and regulatory compliance. This can lead to deviations from accepted standards of care, potentially resulting in patient harm and disciplinary action. A third incorrect approach reflects a passive stance, relying solely on existing general knowledge without actively seeking to understand the nuances of different surgical specialties. This can result in a superficial understanding of complex procedures and a failure to anticipate or manage specialty-specific complications, thereby compromising patient safety and violating the principle of non-maleficence. The professional decision-making process for similar situations involves a systematic approach. First, recognizing the need for specialty-specific knowledge. Second, actively seeking out reliable resources such as professional organizations, peer-reviewed literature, and experienced colleagues. Third, applying this knowledge to practice in a safe and effective manner. And fourth, evaluating the outcomes and seeking further refinement as needed. This iterative process ensures that perioperative nursing care remains current, evidence-based, and tailored to the unique requirements of each surgical specialty, thereby upholding the highest standards of patient safety and professional accountability. Question 20. Examination of the data shows a 72-year-old male patient scheduled for elective hip arthroplasty. His medical history includes hypertension, hyperlipidemia, and a previous myocardial infarction 5 years ago, for which he underwent angioplasty and stenting. Preoperative electrocardiogram, ECG, shows sinus rhythm with occasional premature ventricular contractions, PVC. Laboratory results are within normal limits. The anesthesia team has expressed concern regarding his cardiac risk. As the perioperative nurse, what is the most appropriate initial action to ensure optimal patient safety? Option A. Focus solely on the surgical procedure and the patient's orthopedic needs, assuming the anesthesia team will manage all cardiac-related issues. Option B. Proceed with the surgical schedule as planned, relying on the anesthesia team's vigilance during the procedure to manage any emergent cardiac events. Option C. Ensure a thorough review of the patient's cardiac history, recent cardiac workup, and consult with the cardiologist to optimize his cardiac status and discuss perioperative management strategies before proceeding with surgery. Option D. Administer a beta blocker immediately prior to surgery to reduce myocardial oxygen demand, as this is a standard protocol for patients with a history of MI. The correct answer is C. Ensure a thorough review of the patient's cardiac history, recent cardiac workup, and consult with the cardiologist to optimize his cardiac status and discuss perioperative management strategies before proceeding with surgery. Explanation. This scenario presents a common yet critical challenge in perioperative nursing, managing a patient with known cardiovascular compromise undergoing a procedure that inherently stresses the cardiovascular system. The challenge lies in balancing the need for surgical intervention with the patient's physiological limitations, requiring a proactive and integrated approach to patient safety. The correct approach represents best professional practice by prioritizing a comprehensive, multidisciplinary assessment and planning phase. This aligns with the core principles of patient-centered care and evidence-based practice, which are fundamental to CNOR certification. Specifically, it emphasizes the importance of a thorough preoperative evaluation, including reviewing diagnostic tests and consulting with specialists. This proactive strategy allows for the identification of potential risks and the development of tailored interventions to mitigate them, thereby ensuring the patient receives the safest possible care. This approach is supported by guidelines from professional nursing organizations that advocate for interdisciplinary collaboration and individualized care plans for patients with complex health needs. An incorrect approach that focuses solely on the immediate surgical needs without adequately addressing the patient's cardiovascular status would represent a failure to adhere to the nursing process and a potential violation of the standard of care. This could lead to adverse patient outcomes, such as myocardial infarction, arrhythmias, or hemodynamic instability, which could have been prevented with proper preoperative planning. Ethically, it demonstrates a lack of due diligence in advocating for the patient's well-being. Another incorrect approach that relies on assumptions or anecdotal evidence rather than objective data and expert consultation would be professionally unacceptable. This disregards the scientific basis of nursing practice and the importance of evidence-based decision-making. It also fails to acknowledge the complexity of cardiovascular disease and its implications in the perioperative setting, potentially leading to inadequate management strategies. The professional decision-making process for similar situations should involve a systematic approach. 1. Assessment. Gather comprehensive data about the patient's cardiovascular status, including history, physical examination, and diagnostic results. 2. Diagnosis. Identify nursing diagnoses related to the patient's cardiovascular condition and potential perioperative risks. 3. Planning. Develop a collaborative, individualized care plan that addresses identified risks and incorporates strategies for monitoring and management. 4. Implementation. Execute the care plan, continuously monitoring the patient's response and making necessary adjustments. 5. Evaluation. Assess the effectiveness of interventions and the patient's overall outcome, documenting findings and communicating them to the healthcare team. This iterative process ensures that patient care is dynamic, responsive, and aligned with best practices.